My name is Josh Hamilton. I'm the project manager of the Arnprior Region Ottawa West HealthLink. Our HealthLink is one of more than 90 HealthLinks across the province of Ontario. The HealthLinks are a Ministry of Health and Long-Term Care initiative focused on the top 5% of healthcare user. These 5% represent more than 680,000 clients across Ontario, and just within our small geography, the 2,300 complex clients represent more than $80 million in healthcare spending.
3 years ago, my aunt was affected by early stage Alzheimer, and my dad was actually fighting a cancer. So, since my background was all technology, I decided that maybe that was time for us to try to develop solutions that could actually help people that have complex needs like this. So I funded Aetonix about 3 years ago, and we got started to develop a product called the aTouchAway. We knew at that time that we had to build something that will address complex needs. We had to design something that was extremely easy to use because we were focusing on seniors and people with special needs, and it had to include functionalities that was going to actually enable to care about people like my aunt and my dad.
So I'm a registered nurse. I work for the Arnprior Regional Health. I do patient flow and discharge planning, and I'm also an AROW HealthLink care coordinator. I manage 30 complex patients from Arnprior to the White Lake area. I'm doing what I'm doing because I know I'm making a difference. To deliver the care that's important to the patient and family means it's patient and family-centered goals, and that's been my philosophy. The Aetonix system allows for care conferencing, to be able to connect with other care professionals, to establish patient-centered goals, to look at the care team, to determine together how we can best achieve success and wellness for the patient.
Hello, good morning. How are things?
Because of this system, it's now allowed me to create and have a new life. She's kind of like an ambassador. That's how I look at her, right? She's not just for me, but she's the ambassador for the doctor, whatever. HealthLink is great. This whole system is great. You have to have a quarterback for your team. That's what Lori is, right?
My name is Emily Cody, and I work for Upper Canada HealthLinks. For the future, I see Aetonix helping to reduce the overall wait time by, sometimes a patient will call, and it can sometimes eliminate an unnecessary emergency room visit or a visit to their doctor's office. The reminders for medications, appointments. We've had people really like that their care team can all securely send messages.
My name is Jessica. I'm a care coordinator with Upper Canada HealthLink. It's been really beneficial for some clients. The reminders are, a really big part of it. Med reminders, appointment reminders.
Hi, I'm Dr. Marilyn Crabtree. With the aTouchAway app, I've been able to remotely manage several patients with their complex and changing medical needs, successfully keeping them out of the hospital as well as the emergency room, because I was able to provide recommendations directly to the patient themselves, to the nurses in the home, or to their family caregivers. It's like bringing the clinic directly to the patient's home. One of the patient stories I'd like to tell you about with using the aTouchAway app involved a fellow in his 80s who had heart failure. He was not doing well. His family kept bringing him back and forth to the hospital because he would get short of breath or his legs would swell. And it was really challenging to manage him as his home was 20 kilometers distant from my office. Because we were able to put Aetonix aTouchAway into the patient's home, his family as well as the patient himself was able to communicate with me whenever his legs would swell or he would get more short of breath, and we were actually able to keep him successfully out of hospital other than a few very brief stays over the course of about a 12-month period. And he was able to stay at home until his last few days when he did go to hospice, but remained in the home for probably at least 8 or 9 months longer than he would have without the aTouchAway app.
And it's really a great opportunity for Aetonix to change life of people and making something that really matter. So we're really proud of it and looking forward to really help all Ontarians.